Hello everyone, this is Dr. Rao and the program I teach medical students. Today I am going to talk briefly about Down syndrome. Look at this picture of the child with Down syndrome. A happy and ever smiling, with his tongue protruded and looks happy all the time. We are going to touch on this topic. We give a brief introduction and discuss about the genetic basis of Down syndrome, clinical features, and diagnostic workup and steps of management and prognosis. Well, it was in 1862, Janel Down, an English physician, described this syndrome. It is a most common cause of genetic mental retardation caused by the presence of extra copy of the 21 chromosome. Okay, it could be full or partial copy of 21 chromosome. Okay, usually associated with growth failure, intellectual disability, and other characteristic features. If you look at the face, the dysmorphic features in the face definitely give a clue that patient is Down syndrome. That means by looking at the face, you can make the diagnosis. Okay, we are going to describe the phenotypic appearance of the child with Down syndrome. Parents of the affected children are normal. Mother more than 35 years of age and a child with Down syndrome in the family are risk factors. Well, in such occasions, prenatal screening of the mother is always advisable. Treated by education support, but as there is no cure. Well, an estimated 5.4 million children as on 2015 with 26,500 deaths annually. The rate of occurrence is 1 in 775 live births. It appears to be very high with regard to genetic syndrome. Molecular basis are genetic. It is chromosome aneuploidy. Wherein there is abnormality in the number of chromosomes. Okay. 21 trisomy is a cause for this Down syndrome. That is, there is one extra copy of the 21 chromosome. Sometimes there could be 46 chromosomes, but there is additional genetic material related to 21 chromosome in the individual. How does it happen? That we are going to touch in course of time. Coming to the cell division. Gametes are formed through meiotic cell division, that is reduction division. Meiosis occurs in two stages, meiosis 1 and meiosis 2. Meiosis 1 at the end of the cell division, that is prophase, anaphase, metaphase, and telophase. Two daughter cells are formed with haploid number of chromosomes. Okay, at the end of the meiotic cell division, the cell undergoing cell division is diploid component. and you will get half of the number of chromosomes at the end of the cell division in each daughter cell. That means you get two daughter cells with haploid component, that is 23 chromosomes in each daughter cell. Then this particular cell goes into meiotic 2 division. At the end of the meiotic 2, total 4 daughter cells are formed with haploid component. Meiotic 2 is a sort of mitotic division. Meiotic 1 is reduction division. Well, look at the meiosis. Yes, the cell undergoing meiotic division. Ultimately, gametes are formed, enters into the meiotic cell division. At the end, it gives rise to 4 gametes with haploid component. Then what happens in Down syndrome? Why should the Down syndrome occur? What is the abnormality related to the cell division in order to form the gametes? Due to presence of extra copy of genetic material on 21 chromosome is the reason why the Down syndrome baby is born. It could be due to non-injection, which occurs in nearly 95% of the cases. Okay, it could be mosaicism occurring around say 5 to 10% of the cases, and translocation in 5% of the patients. Non-injection is pre-fertilization event. That means it occurs during the formation of the gametes. Okay, and at the end of meiotic 1 division, one gamete will be having 24 chromosomes instead of 23. And if it gets fertilized with a gamete with 23 chromosomes, it results in zygote with 47 chromosomes. So individual born out of non-disjunction will have the 47 chromosomes with 3 copies of the chromosome 21. What is the mosaicism? This is the situation wherein there are 2 cell lines. One cell line has got the 46 chromosomes, another cell line has 47 chromosomes. This is a post-fertilization event wherein fertilization has occurred, zygote has formed, which has got the 47 chromosomes component, and during the process of cell division, there occurs the non-disjunction with one cell line having the 47 chromosomes and the cell line having the 46 chromosomes. The cell line having the 45 chromosomes gets destroyed. Okay, the cells with the 47 chromosomes and cell with the 46 chromosome, they survive, forming the individual with mosaicism, Down syndrome. Then another phenomena wherein the Down syndrome is possible is translocation. Translocation is a phenomena wherein break in the chromosome with relocation of the segment onto the different chromosome. That is, it usually occurs, break occurs in the long arm of the 21 chromosome at the junction with the centromere, and it is relocated onto the short arm of the chromosome 14. Okay? The chromosome number 14 will have a copy of the chromosome 14 and a copy of the chromosome 21 in the gamete. Okay? That is abnormal or translocated gamete. Okay? If fertilization occurs between this gamete and with the gamete with the normal component of 21, the resultant will be the additional 21 chromosome material, despite the fact there are only 46 chromosomes. Okay? This results in the clinical syndrome, Down syndrome. We'll look into that. Well, before you look into the abnormal karyotype, study the normal karyotype. This is the normal karyotype having 46 chromosomes. That is 23 pairs of chromosomes. This is 22. This is X chromosomes. Okay. Well, this is the karyotype showing non-disjunction. Here you see the 3 copies of 21 chromosome. Okay. This extra copy has come into this particular individual because of non-disjunction. During cell division, the gamete having the 2 copies of the chromosome 21. Okay. Instead of 1. And fertilization occurs with the gamete with 1 copy of the 21 chromosome. The result will be individual having 3 copies of the 21 chromosome. This is because of the non-disjunction. Then coming to the translocation. This situation is called balanced translocation. We have got 121 chromosome and another translocated chromosome 1421. So there the chromosome 14 onto which chromosome 21 has translocated. Okay. And this individual has got normal quantity of genetic material with respect to 21 chromosome, but the number of chromosomes are 45 instead of 46. Okay. Individual with translocation Down syndrome will have 46 chromosomes only, because additional copy of the 21 chromosome is translocated after the chromosome 14. Whereas translocation carrier mother will have 45 chromosomes only. Okay. And she is asymptomatic. Look at this karyotype. Here 21 chromosome. There is a pair of chromosomes here. Okay, chromosome 14 has got extra copy of the chromosome 21, which is translocated from 21 long arm onto the short arm of the 14 chromosome. So there is extra genetic material related to the chromosome 21 in this particular individual. Okay, but total number of chromosomes with translocation Down syndrome is 46 or 45. It is 46 chromosomes. Okay. And non-injection individual Down syndrome have 47 chromosomes. And 45 with extra copy of 21, the female is carrier for translocation gene. So what is how the translocation takes place? Look at the phenomenon. This is called Robertsonian translocation. Look at this particular picture. This is 14 and 21 chromosome. Both are normal. This is a pair of 14, chromosome 14. Okay. This is 14 plus 21. That is with translocation 21 chromosome on 14, otherwise called trisomy 14 here. See, 1, 2, the 2 copies of 14 here, 1 copy of 14 here. This is trisomy 14. This is lethal, won't survive. Lethal. This is 1 pair of 14, 1 pair of 21. This is a normal individual. Then coming to the translocation 21 is Down syndrome. How many copies of 21 are here? 1 translocated 21 sitting on the chromosome 14 and 2 copies of 21 here. Total number of 21 chromosomal copies are 3, but the total number of chromosomes in that particular cell is 46 only. So translocation Down syndrome will have 46 chromosomes. Okay. Then here there is 1 copy of 14 and 2 copies of 21. This is monosomy 14. Either won't survive. Then monosomy 21. That is 14 chromosome is 2. There is one copy of 21. This is again lethal. The baby won't survive. Even the cell division, with 1 copy of the 21 and 2 copy of the 14 won't survive. Then here is the cell with chromosome 14(1), translocation 14(1), and another copy of 21. So total how many copies of 14 chromosome? There are 2 copies of chromosome 14. How many copies of 21? 21 chromosome with full complement. Another with the long arm of the 21, which is functional, getting translocated on chromosome 14. Okay. Short term of chromosome 21 is non-function, does not carry any genetic information. So long arm of the 21 chromosome is translocated on the chromosome 14. Okay, and the chromosome 14 with 21 chromosome translocated onto it, one copy, and one copy of the chromosome 14, and one copy of the chromosome 21. So total number of chromosomes in this particular individual will be 45 only. The female with 45 chromosome with translocated 21 chromosome is translocation carrier. Okay. Well, this woman is asymptomatic, does not have any features of Down syndrome. Usually younger mothers, then they give rise to babies with Down syndrome. How? Well, this cell undergoes meiotic cell division to form the gametes. If the gamete is formed from the cell division, meiotic cell division 1, okay, one copy of the 21 chromosome 2 moves to one daughter cell, and one copy of the 14 chromosome moves to one pole, and 1421 moves to one pole. That means one copy of 14 and a copy of 14 plus 21 moves to one pole, and only 21 chromosome, one copy moves to another pole. So one daughter cell will be having chromosome number 14 and chromosome 1421. Okay, this is the haploid number, right? Because the gamete is formed from the mother cell, that is 45 chromosomes. At the end of the meiotic cell division, one daughter cell will have the 23 chromosomes, and the other daughter cell will have the only 22 chromosomes. Okay, that is one cell with one copy of the chromosome 14 and one copy of the translocated 14 chromosome, that is 14 plus 21, that is one cell will have the 14 plus 21, that is normal. Another cell will have the 14 plus 21, this is abnormal cell. Okay, that is gamete, and the other gamete will have only one copy of 21, no 14 at all. This is lethal, and that particular cell won't survive. The gamete with the 14 plus 14 and 14 plus 21 will fertilize a gamete with one copy of 14 and one copy of 21. So the resultant individual will be having one copy of 14, one copy of 1421, and one copy of 21. Okay, and like this. There is the translocation. This one. The individual will be having two copies of 21 and one copy of the 14 and one copy of the translocation 14. And total complement will be 46 chromosomes. Okay, that's what happens in translocation Down syndrome. Translocation Down syndrome, how many chromosomes the individual will have? 47 or 46? It is 46. And the additional genetic material of 21 is sitting on 14 chromosome. Okay, with two normal copies of 21. Right? Now the total chromosomal number is 46 with abnormal 14 with 21 chromosome. So that is why there is additional genetic material of chromosome 21 in this particular individual, though the total number of chromosomes is 46 only. So now you got the point. In non-disjunction Down syndrome, the total number of chromosomes is 47 with 21 trisomy. Whereas in translocation Down syndrome, total number of chromosomes remain 46, but there is additional copy of the chromosome 21, which is translocated on chromosome 14. Okay, so the chromosomal pattern of Down syndrome with translocation is Down syndrome is two copies of the normal 21 chromosomes, one normal copy of the chromosome 14, and one abnormal copy of the chromosome 14 with added chromosome 21. Okay, that is translocation Down syndrome. Understood? Whereas translocation carrier, that is the mother, will have how many chromosomes? 45 chromosomes only. Having with one copy of the normal 21, one copy of the normal 20, normal 14, and one abnormal 14 with translocated 21. So total number of chromosomes in the mother with translocation carrier is 45 chromosomes only. And the mother is symptomatic or asymptomatic? Asymptomatic. Phenotypically normal. Okay? Because total quantity of the genetic material with regard to 21 chromosome is normal. Okay? So what are the clinical features of the child with Down syndrome? Look at the face. Physical features. Brachycephaly. That means there is shortening anterior posterior diameter because of flattening of the occiput. Depressed nasal bridge. Epicanthic folds. Okay. Upward slant of the palpebral fissure. Brush filled iris. Small chin. Thick protruding tongue. Hypotonia. Short neck. Need not be always. Clinodactyly, that is inturning of the little finger. Simian crease, that is single palmar crease. Wide gap between first and second toe, that is saddle toe. Out of all the features, what is the most important diagnostic feature in Down syndrome? Anybody? Guess. This is upward slant of palpebral fissure is the important feature for diagnosis of Down syndrome. They'll have short stature, increased risk for obesity, intellectual disability. Adults reach the intellect of 6 to 8-year-old child. Okay. Understand better, expression is poor. Why not? They will smile. Intellect declines as the age advances because they are more prone for Alzheimer's disease. Hearing and vision disorders more common in children with Down syndrome. They occur in more than 50% of the children with Down syndrome. They have strabismus, early cataracts, keratoconus, and glaucoma. They are at risk of developing these problems. Refractoriness because of the presence of brachycephaly, because the anterior posterior diameter of the eyeball is short. They develop most frequently otitis media, leading to deafness, chronic ear infections, poor function of the eustachian tube, excessive wax, sometimes sensorineural deafness. You see the eye showing the brush field, spots, brush field iris. Coming to neurological manifestations, delayed milestones of development. Mostly they crawl around 10 months, walk at beyond 2 years because of hypotonia they cannot stand properly. Walking is delayed. IQ, mostly mild to moderate intellectual disability. IQ between 35 to 69. Mental mental makeup, that is mental illnesses. They are not ill mentally, but they are generally happy. 30% develop mental illnesses. Autism accounts for 5 to 10% children with Down syndrome. If they develop seizures, increased risk for infantile spasms. 5 to 10% develop epileptic seizures. Then coming to cardiac anomalies. 40% of the newborns, they are diagnosed with congenital heart diseases. That is, newborn period you can look for, you can identify 40% occurrence of congenital heart diseases. Few are lethal, few are non-lethal. There could be AV septal defects, endocardial cushion defects. This is the lethal. Ventricular septal defects. They survive. Okay. Tetralogy fallows. They do survive. Isolated tetralogy fallows without any other complex anomalies. They survive with early surgical intervention. PDA can be corrected. In these children, surprisingly, less chances for atherosclerosis. And children born with the lethal cardiac anomalies, they perish in the early neonatal period. And children with the either patent ductus arteriosus, isolated ventricular septal defect, they survive for longer time with early cardiac surgery. Hematological malignancies like lymphomas or leukemias are more common in children with Down syndrome. Testicular cancer is something sometimes very frequent in these patients. Okay, develop cancer from germ cells. 10 to 15 times more common in Down syndrome is leukemias. ALL 20 times more common than the children with normal population. No, AMKL is 500 times more common. Coming to non-blood cancers, low risk for solid tumors due to presence of tumor suppressor gene on chromosome 21. Okay, cancers of breast, lung, cervix are relatively low. So solid tumors are less common because there is suppressor gene located on chromosome 21. Other problems. Hypothyroidism is very common in children with Down syndrome. Coming to GI anomalies, duodenal atresia, tracheoesophageal fistula, Z is very common, Meckel diverticulum, and Hirschsprung's disease. They are more common in children with Down syndrome. Dental anomalies and fertility problems are again very common in these children. Well, this is how you can make out the diagnosis of Down syndrome with this spectrum of manifestations. Diagnosis can be done before birth or after birth. Mothers with the risk factors. One child Down syndrome in the family, irrespective of the maternal age, should be screened for Down abnormal karyotype before birth, before pregnancy itself. Then, after pregnancy, well, screening programs during the early neonatal period will help you to make the early diagnosis of Down syndrome antenatally. Then how do you go about the management? There is no cure, so supportive care, educational, occupational, and preventive care. Okay. There is special educational programs for these children with Down syndrome are at par with the children with mental retardation. And rest of the physical support, nutrition, etc. Screening time to time for the occurrence of immunological malignancies and prevention of recurrent infections with adequate immunization. Okay, will improve the lifespan of the individual. Okay, this is all about the Down syndrome. Thank you very much for patient listening. But a note on the prognosis. With major congenital anomalies, most die within 1 year. Because I told you earlier, if there is lethal congenital cardiac anomalies, they perish in first year of life. Mosaicism Down syndrome, they survive longer because of the um, few clinical manifestations which matches with the long time survival. Most Down syndrome survive beyond 50 with skillful management. Okay. Well, thank you very much. This is all about the Down syndrome. A smiling, happy child, mentally retarded, hypotonia, and delayed milestones of development, recurrent ear infections and chest infections. Well, survive long time with supportive care and adequate nutrition. And if they receive adequate immunization and the occupational training, they can be put into any jobs which do not require skill or literacy. And most of the children who develop into adult age, we have seen these children put into, say, about the security guards, etc. Thank you very much for patient listening. We'll see you again in the next class. Until that time, bye bye.